Hi, hello, welcome back to another live stream with Askawayhealth. I'm Dr. Sylvia, a general practitioner and health educator. I'm so glad that you found time to catch up with me again. We didn't have a stream last week, yes, because I was teaching, and I know I've said our streams are going to be a little bit ad hoc, maybe every couple of weeks now, but I will try to see if I can get a regular upload on Fridays. But whichever the case, I will let you know in our community post. So please keep an eye on that. How are you guys doing? I'm so pleased to have you here. Let me say happy Thanksgiving to my American viewers. I hope you guys have warm, peaceful, joyful celebrations with your family. And to everyone watching from different parts of the world, as usual, you're very much welcome. So today we're talking about the changes that happen with period blood after taking the pill. And my focus is on the morning after pill, but a little of this can apply to the regular pill, particularly the progesterone containing pill. And as usual, it's come on the back of a question from one of you guys. So thank you. As usual, I really appreciate it when you watch a video and it prompts more questions. That is the purpose of our channel. It's to provide you with information. So I'm really glad. Let me quickly share the question, and then we can look into different issues around what happens to the period. And I actually realized I haven't really thought about it much, which is funny because I do talk about what happens to your periods after you've taken the pill. I'm sure I've got 2 or 3 videos on this subject, but I've not really talked about what happens to the appearance of the period, of the bleeding, or the type of the bleeding after you've taken the pill, which is the focus of this video. So let's share the question and read it together. So hopefully you guys can see this with me. Okay, so this is from a viewer. She says, I took the post pill 2 days before my period and it delayed it for 3 days. On the 3rd day, I started seeing brown blood coming out, and I thought the next will be normal blood, but yet I'm still seeing the brown blood. What could be the cause? So that is a question. I do get quite a few questions like this, I have to admit. And not necessarily just brown blood. It might be a brown looking or mixed ready brown looking blood, or black or dark looking blood after taking the pill. Or in other instances, and people wanting to know what's responsible for it. So it's a fairly common question, and I thought it was really good that it's triggered me to bring it forward so that we can look at it today. So guys, while we're going to start tackling the question, please don't forget to give the video a like. And of course, if you're just joining, don't forget to subscribe to the channel, leave a comment. Hi Nkechi, nice to see you. Yeah, I'm glad to be live. I hope you're well. Happy Thanksgiving. Hope your family is good. Yeah, so guys, please don't forget to like the video. Let me just put up I forget to remind people to like, so let me put that up now that I've remembered, and I'm going to leave that there. So please remember to give the video a like and subscribe. Okay, so yeah, if you guys are watching from the States, tell us how you're spending Thanksgiving. What are you guys doing? What's special planned over the weekend? Okay, so let us begin. Right, so period blood and what it looks like after the pill. So let's start with basics. Where does period blood come from, or what results in period blood? And there was a video a couple of weeks ago, which was part of my mother to daughter series, but then I sort of tried to break it down to the basics. That period blood is blood that is a combination of the the breakdown of the egg, if you've ovulated that month, of the egg, and then parts of the womb lining. So it's all on a continuum. The whole thing is a process, right from the start of the cycle to when you ovulate and what happens to the egg after ovulation, and on to after the egg dies, which it does within 24 to 48 hours. And then the womb that's been preparing, all the while the egg was maturing, the womb was also preparing. And at the point where ovulation has happened and no fertilization happens, so there is no pregnancy, then the womb begins to, that lining begins to disintegrate. And all this is what is shed as menstrual blood. This is the component of menstrual blood. So the appearance of the blood depends on a few things. Depends on how much there is, and sometimes you could have bits of old blood from a previous period hanging around in the womb that wasn't shed at that period. It's just old blood that will then be shed alongside in the next month, and that gives a little bit more bulk to the period and might affect the way that it looks. That's one. So it might be that the amount of blood is a lot, and then it might be that the blood is going through quite quickly. So particularly the first couple of days of the period, the flow goes quite quickly because there's a lot to come through. And then sometimes as the period comes to an end, as it comes to the last few days of the period, the flow slows down, and that might also affect the color, which we'll talk about. So this is where the period comes from, and this is what causes the period blood to change in color. It could also mix with other parts or other fluid within the cervix and vaginal canal. So all this can contribute towards what you're seeing. And I'm trying to keep that to a normal period because there are other things that are abnormal that could cause a change in the appearance of the period. So I'm going to touch on them, but remember that our focus is on the pill and what happens to the period blood after the pill. So let me put up, let's see if I've got the right one. I wanted to start with, I hope this is the right one. Yes, so let me put up this and we're just going to look at it. So when you have a normal period, just like I've explained, within the first couple of days, you have a regular flow or a little bit of a quick flow because there's a lot of blood that needs to come out from the womb, but it exits the womb at a normal pace. It's sort of flowing, and that's what you find on the tampon or in the cup or on the towel, the sanitary towel, that there is a sort of fresh red blood appearance to the period. So that's what we expect as normal. Sometimes the blood is a bit lighter, so we talk about light red blood. And again, that can be normal in the context of the blood moving quickly as it exits the womb. But now we're going to start talking about the normal and then the abnormal as I show you a series of images, okay? So you may have light red blood in the context of a miscarriage because there is a good amount of bleeding going on, and it may mix with fluid coming from the cervix as it opens, because that's what's happening in a miscarriage, that the cervix opens and the pregnancy is coming through. So this blood may mix with fluid and it looks light red or it's moving quickly. You may also have light red blood in cases where there's an infection, like a sexually transmitted infection, or if there are other conditions like fibroids, where you have a larger volume or the womb lining is stretched out because of the bulk of the fibroid, and you have a lot of blood that's coming through. Key to that, you can also have dark red blood. And dark red blood can be normal as well in the context of blood that has been sort of sitting in parts of the womb that haven't come out yet, maybe in the first couple of days of the period. So it's just been there. But because it's not come through, it's not started traveling out of the womb, it's dark red. Because once it starts traveling out of the womb, the chances of being exposed to air and oxygen are higher. So blood naturally will get oxidized. So let's not forget that if you leave blood just lying on a surface, after a little while, it's mixed with air, and the oxygen in the air, it oxidizes. That changes its color. So the color can go from the red that you see, go a bit darker, start going into brown, and then finally might end up looking black. That is a natural oxidation process. So you might find that the dark red blood that you're seeing is within a normal context, and it's simply because the blood has been sitting for a while within the womb, hasn't yet been oxidized, and that tends to happen possibly towards the end of the period. You could also find it, or women could also find it, who have just had a baby, and it's the first couple of days they've delivered, and then you have lochia, which is the material that is a mixture of blood and any extra tissue coming away from the womb. So the womb essentially cleaning out itself is what lochia is. So initially you may have sort of dark red blood as blood from all the months of pregnancy, all the extra activity, all the extra tissue that the womb has been carrying begins to come away. Again, it might oxidize as it moves through the womb, through the vaginal canal and into the open. So what I'm trying to argue or explain is that even with normal periods, you can have different range of colors. You could have the red blood, fresh, bright red blood that we see. Sometimes it could look a little bit lighter. Sometimes it could look a little bit darker. But be conscious, please be aware that there are certain conditions where you might have bleeding that is an unusual appearance, and it is correct for you to question, what's going on? And part of the purpose of this stream is to explain those instances. So this is as it pertains to red blood. I'm just going to change, and we'll switch to a different appearance of period blood. Let me just catch up with the chat. She has something else. The woman body is just wow. Okay, thank you. Looking forward to whenever this period thing ends. Oh, it's going to end well, don't worry. Right, so let's move. Let me just switch this and let us see the next one, which hopefully should be pink. Yes, pink blood. Okay, so this is when blood looks pink. And, we all know our colors. You think, this is not how my normal period looks. But then again, it could be part of a normal period. So you would see a lighter version. It's not exactly light red. It just looks a little bit different. Mostly it's because the blood has mixed with fluid from the cervix. And if you want to know more about the cervix and how it works, this is not a topic for today's stream. But I do have a couple of videos on the cervix and what it does. Is a fantastic part of the womb. Please go and check that out if you're interested. But anyway, fluid from the cervix can mix with the blood, and you have pink looking blood. Okay, so again, it may not necessarily be anything to worry your head about. It could happen towards the beginning of the period, just before flow starts getting heavy. You remember, when the period starts, remember, it doesn't just start like that. You might just start to get a bit of a trickle, and then you see a little bit of a smear on the pad, on your towel or pad or underwear, and it might just be light because it's just starting, the flow is starting, and within a few hours it increases, the color then becomes the usual red pattern that you see, and this is a period. So that could be a normal event. And the same goes for lochia, which we've just talked about. A woman has just had a baby, her lochia starts, and it may start a little bit darker because she's got a few tissues and blood that are going to come away since she's just had the baby. That might become a little bit lighter, coming to being red and then pink as she gets into the first week from day 4 onwards of her lochia. You could also have pink blood happening in a miscarriage. Remember what we said about mixing when the cervix opens, and so the blood can mix with the cervical fluid. So you could have that going on in a miscarriage. And the other thing I wanted to point out, which is interesting and which relates to the topic for today, is that other instances where you can have period bleeding that doesn't look the same as usual, is when there's some kind of hormone imbalance. And there are many, many reasons for hormone imbalance. Let's not forget, okay? So hormone imbalance, commonly when there's reduced estrogen, particularly around menopause, when a woman she hasn't really entered menopause fully. She's still seeing her periods, but they're irregular, they're different. They're not as long as they used to be. They're a bit lighter, the color is a bit different. That can be happening because of low estrogen. And other conditions where that can happen is something like polycystic ovary syndrome, PCOS, where again, ovulation is not regular. And you have irregular, imbalanced hormones that explain why ovulation is not regular. But another circumstance, another scenario where you can have imbalanced hormones is when a lady is using the pill. So you could have pink blood because of the pill. Now, with the pill, for example, the morning after pill, you take a dose of this tablet, which is progesterone. For most of them contains progesterone. And so this progesterone, at that time, the amount of progesterone in your body is a bit higher than the amount of estrogen. So that little imbalance can also affect the womb lining and result in blood flow blood appearance of the bleeding that is not your usual. It can affect the womb lining so that blood comes away from the womb at different times. And so when they mix together, they look different. They don't look like the regular flow you will get on your period. This is something that is similar that can happen with taking the regular progesterone-only pill, that is the daily pill, because also that contains progesterone, remember. And when you're taking that on a regular basis, you will have a higher amount of progesterone in your system compared to estrogen, and that can affect the womb lining, can affect the pattern of release of blood and tissue from the womb, especially for people who have periods. They may notice that their period looks a little bit lighter than usual, or looks a slightly different color than usual, simply explained by the change in the hormone levels, because after they stop taking the pill, things come back to normal. And for someone who observes that she took the pill a couple of days ago, a week or two ago, and then when she has her bleeding, it looks a different color, this can simply explain it. When your cycle goes back to normal, then the appearance of the bleeding also goes back to normal. So that is how we explain pink blood. Please let me know if you've got any questions. If you want me to clarify any bit of this discussion, please let me know. Just send a question in the comment section. So we've tackled normal well, when I say normal, red appearing blood, which essentially is normal in our periods. We've also explained a few conditions that are also normal, like lochia, where you have the red appearing blood. And we've talked about how and why you could get dark colored blood and it's still normal, and light red blood and it's still normal. And we've just discussed pink blood. So let's look at the one that relates directly to the question, and this is brown blood. So remember the question. Let's put it up again. Remember the question. This lady took post-pill 2 days before her period. So post-pill is your progesterone-containing morning after pill, similar to Take Action, Levanel, if you're in the UK, Postinor 2, what else? Take Action, the I pill. What are the other names? Any one of them that contains levonorgestrel. This is what we're talking about. So she took this 2 days before her period, and she experienced a delay of her period for 3 days. As you remember, because we've talked about this on the channel, remember that the pill, the morning after pill, can have different effects on your period. And I say there are about 4 different things that could happen. Number one, nothing. Your period just carries on as usual. That can happen in some women. In some women, it could delay the period. In other words, they end up seeing the period a few days after that it was scheduled, when they've taken the pill. In some, the period might come a little bit earlier. And in others, there might be a type of bleeding that doesn't appear to be a period. It looks a bit different. And then perhaps a few days later, they end up having a period. That first type of bleeding usually is called bleeding that is unrelated to the period, but is as a result of the pill. So there are different ways that a pill, the morning after pill, can affect your period. That's nothing to do with pregnancy. It's just the effect of the hormone. Okay, so that's the effect on the cycle. For this lady, she had a period delay and it was for 3 days. Fine. That's what the pill does. I can't tell you if it's 3 days or 7 days or whatever. We have a range, but it differs from one woman to another. So on the 3rd day, she started seeing brown blood coming out, and she thought next she would see normal blood, but she's still seeing brown blood. Now, I don't know how many days she's been seeing brown blood. That is the question, exactly the way it came to me on the in the comments section. But like I said, it just triggered me to think about this issue. And I've got a few requests like this in the past, which I've sort of responded to privately. But I thought, well, since we're getting this a bit more frequently, maybe a video would be a good idea. So should she be worried about brown blood? In the first instance, just given the little information that she's given to us, no. Because brown blood or brown appearing period blood could be the sign or the appearance of a normal period. It could even be at the beginning of the period. Remember, I said that sometimes as you start, you have just a little bit of bleeding. The flow hasn't really gotten into, it's not really got going yet. It's just starting off. So as tissue begins to come away from the womb and it just gains traction, things begin to flow quicker, and then you have the red blood that we're all sort of familiar with. But initially, you might have brown blood. And the same towards the end. Towards the end, there is not so much product or material left in the womb. Pretty much everything has gone out. So it slows down to a trickle. Things are moving slowly. The flow reduces. So what happens when the flow of blood reduces is that it has a lot more time to be exposed to air as it comes out of the womb, out of the vagina. And this is, again, oxidation. The blood is getting oxidized. So the blood will be oxidized from the normal red that we're used to a darker color, to brown, and then into black if it's left, for some time. This is just the effect of the blood. Now, in her case, this might be what's going on. But I think there's also the element of the effect of the pill, which I've explained from the previous slide that we saw, pretty much the same thing, that because she's taken this extra bit of progesterone, it affects the womb lining. The way the womb lining releases blood or releases tissue is not regular. So you could have that some bits of the womb lining come away slowly, some come away quickly. And this mixture, as they travel through the womb and the vagina, can also be oxidized, causing the blood to look a different color to normal. It is an effect of the pill. Okay, so it could be that this brown blood is simply the effect of the pill that she's taken, the progesterone that she's taken. But there are other reasons that brown blood may happen. So let's quickly go through them. Implantation bleeding. I get a lot of questions. Oh, I took the pill, blah, 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 and I haven't seen my period, but I had a little bit of spotting. Is it implantation bleeding? There's no one that can tell you. Really, the thing is, that's the thing about the pill. Nobody can tell you whether this bleeding is implantation or it's an effect of the pill, or maybe it's an early period that's just starting. A pregnancy test is what will tell us, and then retrospectively we'll say, oh, actually that was implantation bleeding. Yes, you can say things like, well, implantation bleeding is usually not as heavy as a period. Yes, you can say things like, well, it'll happen 6 to 12 days after you ovulated. You can sort of use those things to guess that this may be implantation blood. You can even use the color, that period blood is bright red or it looks fresh, while implantation blood doesn't look that way. It's a different shade. It might even be brown. But the final determinant, what determines things, the final determination is with a pregnancy test. So I know it's difficult while you're waiting, the anxiety, you have to wait a couple of weeks before you can do a urine pregnancy test, but really that is how we will tell, or how we would know. So you can also see brown blood after having your baby with lochia. Also in miscarriage, when there's a missed or silent miscarriage. Now this is a miscarriage that nobody realized had happened. And because there wasn't obvious bleeding, the pregnancy had remained in place. And even up to 4 weeks, up to a month, the pregnancy had remained in place without any visible bleeding. And then suddenly, slowly, the womb opens, or the cervix opens, and we start to see brown blood or altered blood. So it's not red, it just looks different. This could be because this tissue, that pregnancy that had miscarried 4 weeks ago but just remained in the womb without giving anybody any notice, is now coming away. And because it has been there for so long, it started to decompose, if you like. It started to change. Of course, the pregnancy is lost, the fetus has died, and what the body will do is begin to try and change, begin to try and heal itself. But the womb will have to open so that the pregnancy comes away, and the appearance is not going to be of fresh tissue, it will be of old tissue which has already died. So that is why brown blood or discharge might happen in a silent miscarriage. And again, I've explained about why you could see it after the pill, which is because of irregular and imbalance of the hormones. The same thing that you can find with people around menopause, or people who have PCOS. So brown blood can be a normal appearance of your period, depending on which stage of the period it is, early or late. It could be because of slow flow, but there are some abnormal situations like a miscarriage I've just described where it could happen. It could also happen after you've taken the pill. So just to make sure that we're all on the same, on that page, or understanding that, please don't necessarily panic when you see brown blood. And the other thing I want to mention here is also infection, like sexually transmitted infection. And how would you tell? Because you think, well, if it could be the period, how can I tell whether it's a period or infection? Well, the thing about infections is that they also tend to come with other symptoms. So feeling very ill, fever, pain, and that could be pain during sex, or just pain on its own within the pelvis or the lower abdomen, or across your sides and your back, pain passing urine. Any of those things with an abnormal discharge, that is a discharge that does not look like your normal period. Oh, and of course, a foul odor. That is, you can smell that there's something, this is a different smell. It is not period blood smell. This is a different, and it's offensive. Please speak to your doctor. Okay, so if you're just joining, thank you so much for catching catching on to this live stream train. Thank you for joining. So pleased to have you around. I hope you're doing well. We're just talking about period changes after taking the pill. And I am on my way to establishing the fact that you can have different appearances of period blood that is normal. So the period blood can go from the normal red that we're familiar with, or light red or dark red. It could also be pink. It could also be brown. We've just finished talking about brown. But I'm also wanting to share the information that there are other conditions where you could have this abnormal appearance, or you could have this a different appearance of the period and what it could mean. Particularly when you've taken the pill. So you shouldn't panic necessarily. The key thing will just simply be to monitor this bleeding, monitor the quantity. What does it smell like? Do you have other symptoms like pain, fever? Do you feel sick? Okay. And then how long is it has it been going on for? It might just carry on for a few days, and then you find that things begin to settle down. But if you have any of those symptoms that suggest that you're not well, for example, an infection, or if you find that the bleeding or the discharge or blood is getting heavier, then you should seek medical attention. So the last one I wanted us to look at is black blood. And of course, this is extremely alarming. I mean, if brown is not alarming, how if brown is alarming, how much more black? You go to change yourself or change your underwear, or go to wee, and black. Of course, that's extremely alarming. However, if you've been here from the beginning, I've said it so many times, it could be a normal appearance of a period. Either one that is just starting again, the flow is not very fast, it's sort of trickling down, and it's had time to be exposed to air, and air has oxidized it. Or towards the end, many of you will be familiar, as you end the period, maybe the last day or even the day before, it's sort of trickling, is just smearing, and then you have dark looking material, and it's simply coming to the end. Or if for young girls who are just starting their period, they may also have that. You have different colors, and it's good that we talk to our daughters. I'm championing this mother to daughter thing because I think that perhaps a lot of us girls didn't really hear so much about our bodies, and we found things out as we went along the way. Maybe because as you're growing up, they didn't talk about these things. But it's important that we are sharing information with our younger sisters, our daughters, so that they're armed with this information. Nothing frightens you about your period or your body. And with that empowerment, they can make the right decisions. Choose, for example, to say, well, I'm not going to have sex because I'm not ready for it. I'm interested in it, but not at this point. It's not the best for me. And they can make that decision, own it, and be happy in themselves, and not just led on with peer pressure. But I'm digressing. Let's come back to periods, or what we're talking about. If you want to watch the Mother to Daughter series, I'd love a lot of support there. Please go and check out the playlist. I'm trying to develop it, but any support that you can give by watching and liking the videos would be amazing. So black blood, similar to brown, because it's that process of oxidation. Old blood that's been in the womb for a few days, slowly trickling out, because the womb is like a pear shape, okay? And as we're having our periods, blood isn't just sort of flowing down. What I'm saying is that the blood comes from different parts of the womb, but different times, different phases. It's not just the whole chunk just comes out at once. It's sort of a little bit of removal from one part of the womb, then the next part, and it goes that way. So you may find that over the 5 or whatever number of days of the period, some parts may have cleared and some parts may not have emptied. So you have old blood, and that's slowly traveling down, coming out of the womb slowly, that mixes with air and becomes oxidized. Okay. However, let's talk about the abnormal, because sometimes you can have black blood in abnormal situations. For example, if objects are left behind in the vagina. Most common is a tampon, a forgotten tampon. And yes, I have removed a few in my time. And yes, you definitely see black. Definitely. Okay. Apart from the nasty smell that comes with it. And of course, this is a serious condition. No jokes here. This is a serious condition because it can lead to toxic shock syndrome. So please always check your tampon. And I think the last person I saw actually managed to put a fresh tampon on the old one. I don't know how, but she managed. And so it's possible. It's possible accidentally. She managed to do that. And I think it was just the odor. that alerted her. She started thinking, what's going on? And lo and behold, it was a tampon that was lodged high up within the vagina. Of course, menstrual cups may be forgotten. Yes, it's possible. Or sexual toys may be forgotten within the vaginal canal. And so those objects staying in there, you have blood and bloody material there. They take some time to come away, and as they are slowly coming away, they are oxidizing. Okay, so that is an abnormal situation where you could have black blood because perhaps some decomposition has already been going on in the body. Again, infection, sexually transmitted infection, or their senior brother or senior sister pelvic inflammatory disease is also important. So you could have a black discharge. In that case, pain, again, fever, not feeling well, nausea, vomiting, odor. Those are the clues. So if somebody has that kind of black discharge going on with those other symptoms, again, it could also happen in the miscarriage, the missed miscarriage, which I just explained, where the miscarriage, nobody realized that she didn't realize she was pregnant. And for more than a few weeks, up to 4 weeks, before the womb eventually opens and begins to release the material. At that point, the pregnancy has already died. So what is being released is old material. So it might look brown, it might look black. And then, of course, lochia. Well, this is normal, but lochia, by the time you're getting past the first, how will I describe it now? By the time you're getting past the first, week, or getting into the second week, the flow has slowed down. So most of what was going to come out of the womb has come out. So you're getting just a little bit that's trickling out. And again, what happens is that as it comes out, it's small volume, is moving slowly, it's exposed to air, and it is oxidized to black. So for a woman who's just had her baby, she's had her lochia, initially perhaps dark red, then it becomes sort of fresh red as the womb is cleaning itself out. Then towards the end of that process, it begins to look a little bit black, but that's just because it's a little amount of material left in the womb that's coming away. It's slowly coming away, so it's exposed to air and it's turning black. So we can explain these things. So just to go back to the question that brought us here, what could be the cause? So for example, if you're just joining and you didn't see how we started with this, the cause, as I've explained, could simply be that it's the extra hormone that's acting on your womb lining. Now, if you look at her story, she said she took the post pill 2 days before her period, implying, and again, this is all that we've got. We haven't got any more, implying that maybe she met with her partner at that time. The chances of pregnancy here are really quite low around the period, because this suggests to me that ovulation, if she had a regular cycle, ovulation has probably happened more than a week ago. So the chances of her being pregnant are quite slim, quite low, but which we advise you to, because everyone's ovulation might change from time to time. She might have a short cycle. We don't know. We advise people, don't just think, oh, this is a safe time, I'm probably not going to get pregnant. Yeah, you can think that, but if you definitely don't want to get caught, it's better that you take the pill. So I don't think implantation bleeding comes into this at all. I don't think she would have gotten pregnant at all. I think this is probably an effect of her period. So without any more information from her about anything else going on, whether she has any other symptoms, I can't say. But I've explained that brown blood could be an appearance of a normal period, or it could be because of the pill that you've taken. And we've seen other situations where brown blood could happen. We've talked about miscarriage and so on. I don't want to belabor the point. And I didn't really want to make this a very long stream. So I'm glad that we sort of managed to cover those different areas. So this is it, my friends. Please, it's always good to be alert. And yes, if you see something that looks unusual, please ask. Okay, we're here. You can talk to your medical provider. Ask if you're not sure. That's perfectly fine. Okay, so that you can clarify. And if there's anything that needs to be sorted out quickly, we can get it done. Okay, so I hope that's been helpful. Let me know in the comment section. Please don't forget to like the video. And as you go into the weekend, I hope you have a very peaceful and restful one. Don't forget to check out the latest video I published, which was yesterday, and which is on the topic, I can't even remember the topic of my latest video. Give me a second to think. Or actually, let me see if I can pull it up on YouTube and find and find it. Oh yes, it was about I found it. It was about excessive eating in pregnancy. So, are you eating? Are you devoting yourself to eating to support your baby? Is there a specific amount that you shouldn't go beyond? Or what exactly are you supposed to do when you're pregnant? And are you supposed to be eating for two? But I put a lot of information in that video, especially what's healthy and things to avoid. So please go and check it out if you haven't done so already. Thank you so much for everyone who stuck with me through the end. Really appreciate that. Please don't forget to like the video as you go away. And I hope it was of value to you. And I hope I'll see you again next time. Thank you. Bye-bye.